Now let's talk about certain etiology and pathogenesis of primary sclerosing cholangitis. As we talked about in the previous slide, there has not been any documented evidence of pathophysiological mechanism. All the pathophysiological mechanisms are generally various theories that have been postulated. But the major common point of all of these theories is that in some problem that causes an injury to the cholangiocytes or the the bile duct cells. What can be the various postulated pathogens? There are certain dietary exposures in certain population. In certain posh population, primary sclerosing cholangitis occurs after an underlying infection, for example, a viral disease, someone who is infected with a viral disorder and gets better. So the immune system revs up and then starts attacking the cholangiocytes. This is all postulated. Autoimmunity has been postulated for a smaller population of the disease. Certain types of toxins, certain types of various unknown factors. Mostly it is an idiopathic disorder, which means that we do not know what causes this disorder. In patients with ulcerative colitis, it has been postulated that because ulcerative colitis affects the colon and it basically disturbs the normal colonic flora, in patients with ulcerative colitis, this abnormal colic flora can move towards the hepatic bile ducts, and then that can cause inflammation and scarring of the bile duct. But it is also a postulated theory. There has been no documented evidence in support. The common point of all of these trigger factors is some insult to the cholangiocytes or the cells that make up the bile ducts or the hepatic ducts. As a result of this injury to the bile duct cells, there is a reactionary fibrosis or reactionary inflammation. The immune system revs up. There are certain cytokines released that causes the inflammation and the damage to the bile duct, which can undergo ultimately fibrosis or scarring. So this scarring and fibrosis gives rise to what is described on histopathology as an onion skin pattern. Like when you peel the rings of an onion, there are various rings formed. So that onion skin pattern, we are going to show you a slide regarding that in the histopathology section after this slide. So this is postulated that certain type of these, any one of these triggers can lead to an initial insult on which the inflammatory process occurs and leads to damage of the bile ducts. So this leads to narrowing, strictures formation, and alternating dilatation. Whenever there is a narrow part, the adjoining part gets dilated. So this is described as what is termed as beads on a string appearance, like the beads on a string. You have a similar picture of the biliary tract in this disorder of primary sclerosing cholangitis. So finally, there is immune-mediated destruction because of the inflammatory process, and this disease undergoes certain various types of phases. A large majority of the population is asymptomatic initially, and this might be an incidental finding for someone who presents with any other disorder, and when you work up the liver function tests, you found those to be abnormally enlarged. That is also termed as a biochemical phase in which the labs are abnormal, but the patient is not symptomatic. Then that transitions into a symptomatic phase in which the patient starts having the common symptoms like jaundice or problems related to the cholestasis like itching and pruritus. And finally, if the disease is not well managed, if the strictures are not well managed, and if the patient does not have a liver transplantation, which is the curative form, the only curative option, then they can eventually develop decompensated cirrhosis. And all the signs and symptoms of cirrhosis can develop that can eventually cause hepatocellular carcinoma as well. So this disease has a worse prognosis as compared to the other disorders because we do not have a definitive cure for this disease. We just try to manage the symptoms, and the only definitive cure for this disease is the liver transplantation if done very early, because the disease can rapidly progress to liver failure and cirrhosis.